can be living with HIV, but the amount of the virus is so low in you, it can't be detected by a test and it can't be passed on to somebody else. We handed out like over 120,000 condoms last year, I think was
The more the
number.
better, man.
Yeah.
Oh my. Especially around here. Ybor City is a crazy place. All right, today we have Brian Bailey with Metro Inclusive Health, and your title is the VP of Business Development. Explain exactly what you do.
Chief Marketing and Business Development Officer.
Chief Marketing and Business Development Officer.
Yes.
How long have you been at Metro?
Oh my God, August was 5 years.
August was 5 years.
Yep.
So we got connected. I own a building in Seminole Heights that Metro is going to be moving into in a short time, although maybe by the time this podcast gets out there, it'll be available for patients. It's an awesome location. And I didn't really understand what Metro Inclusive Health was. Mm-hmm. You put it in a really interesting way. And I believe it was on an interview. I forgot which news station it was, but you were explaining how, imagine how you feel going into a doctor's office, having an issue, and that feeling of nervousness and uncertainty, and then add on being a part of the LGBTQ plus community. Mm. And I never thought about that. And I thought, wow, there's so many people here locally in St. Petersburg and Tampa that are in that community that really don't have a place to turn to. And that like blew my mind. I thought, what a great supply for a huge demand. Yeah, definitely.
Yeah, no kidding.
So you've been with Metro for 5 years. Tell me about kind of what the business or the operations were like when you joined and how it's kind of shifted over those years.
Yeah, I always position it as we all have at one time or another have to have a conversation with our provider, a doctor that's maybe not so comfortable, right? You always got to have something to say. And then take the fact that you're a member of the LGBTQ community, it's a whole nother level of uncomfort. So it's really good to have a doctor or a provider that speaks your language, I think is kind of the important part of it. When I started with Metro, it's an interesting, and it really is sort of a example of how this market has changed. But when I started with Metro was 2018, and at that time, the focus was these large sort of destination health centers. Mm. And we had one in Tampa, or we had one in St. Pete that was just sort of wrapping up and opening, and then Tampa over in the Ybor area. And we also at the same time had this smaller satellite in Newport Richey and one in Clearwater as well. And, I'm also a bit of a novel investor, so I kind of watch what the bigger companies are doing. And when you look at like what Amazon was trying to do, their intent in getting into local markets, and Walmart was also focusing on healthcare in a regional way. And hit a couple others, Walgreens, CVS, also looking at like the primary care market in regional markets. Back in 2019, it sort of dawned on me that, we couldn't ignore that model, whether or not we stay in these large health centers and then have little satellites, or, maybe it's something different. Well, then the pandemic happened, right? And as everybody says, the pandemic changed everything. So largely, if the influx of people that came to the Tampa Bay area. So you've got a large number of people new to the area. You've got hybrid work schedules, people working either from home or in the office or both. You've got increased commuter times, more density in traffic, all those things. So it became really clear that we needed to take a look at our patient data and see where our patients were coming to us from. And I jumped back to that idea of being a premier LGBTQ provider. That people are seeking out services based on what they need and their comfort level. So it was really eye-opening. We looked all the way back to 2019, pre-pandemic, and then through, I think, end of 2022 is really what we looked at. And we saw that people were traveling to us from very long distances, from as far as like North Hernando County, people coming to us from Lakeland, people coming to us from south of the Skyway. So it was really clear that people were willing to travel for that inclusive care, as it were. And we started really kind of looking at the cost of owning and maintaining these buildings, and whether or not, and as well as the competitive issues, the other people that are coming into the marketplace. But then, what I spent a lot of time doing since 2019 was really elevating our brand. And Metro enjoys an incredible brand awareness in this market. So we really kind of made the decision that, we were going to seriously break down these large health centers and spread them out into these communities. So that's a long explanation.
Yeah.
Jumping just kind of straight to how we ended up in Seminole Heights, that was I sort of led the charge to look at the data, and Seminole Heights was really number one on our list in Tampa. If you drive into any one of those neighborhoods nearby, you see all the pride flags outside and everything, and like that's our people.
Yeah.
So we needed to be in that area. So we really struggled to find a good place. So yours was like the last stand. We thought we were going to have to be a little bit far away, so it really worked out. It was kismet, honestly.
Yeah,
That
it was a
space worked
match
out.
made. I
Yeah.
feel I feel like your team and us have had a great relationship in the past few months, so it's been great. Jumping back real quick to that data you guys were analyzing, why would it be so many of your patients would be coming from so far away? Is there not this type of service available?
I think it's a couple of things. There is that. I would put it in three categories. I go back to the brand awareness. We enjoy a really good brand awareness among the LGBTQ community. We've been around for 30 years, so there's good reason for that. And the other thing is the HIV care that we do is second to none. An example of that is that if you're living with HIV and you're looking for a provider, there is in our industry something that is called reaching undetectable status, which means that you can be living with HIV, but the amount of the virus is so low in you, it can't be detected by a test, and it can't be passed on to somebody else. So 90% of our patients enjoy undetectable status. The state average is 74, and the national average is like 62. So we have a tremendous amount of reputation in doing really well in HIV care. So I think that's number two. And number three, I would say, is it's just one of those things where, you're everybody has an aunt, an uncle, a cousin
Yeah.
that's a member of the community. And so, word of mouth, I think, has been very good to us. And it is, and I'll just kind of jump forward in a bit, just to kind of give an example. So
Sure.
one of the neighborhoods, one of the first locations we opened up was Brandon. It's not an area you would expect to have a LGBTQ plus community, but just proving that our people are everywhere. We opened that location with some services like behavioral health, case management, but it was a good 6 weeks before our actual medical providers started there. He started on a Monday with 3 brand new HIV patients, and we have seen people stop. And it's not, if you've been to Brandon, it's not a walkable neighborhood. You take a car everywhere. We had the minute we put up the sign, people were stopping and coming in and saying, "Is this the Metro I've heard of that does
Wow.
LGBTQ?" So, and people walking in or stopping and coming in for free HIV testing. So it's just been proof of what I kind of thought it would be, and that's where we are.
And the model of going to a more almost clinic, right, versus a big institution hospital with fluorescent lights that you've seen that a lot, like you mentioned, like CVS is kind of opening up their clinics, and I think Walgreens has some component. That's going to be extremely popular moving forward. I think most people don't enjoy going to a big hospital and
No,
waiting
I
in
know.
line. And
Yeah.
so I think the demand for this type of service extends beyond this community. I think most people enjoy a more neighborhood oriented approach to healthcare.
Correct. And I think, people also want to be close.
Right.
we are, traffic density here. We are all dealing with it. And it's no fun to have to drive an hour, 45 minutes to a provider. So I think that is largely what the CVSs and the Walgreens are trying to capitalize on. However, I will say it has not, from what I understand, worked out so particularly well for the Walgreens of the world,
Mm.
just because they don't have you can't recreate that neighborhood personal feeling when I think largely the model is 15-minute visits in and out. The providers there are actually given bonuses on how many patients they see, from what I understand. So it's
Yeah.
they're churning them out, and it's largely Medicaid, Medicare focused.
Yeah, you kind of have some negative incentives there. And I've been to those clinics before and it
Mhm.
feels a little bit like your cattle kind of being shipped through this
Right.
conveyor.
Yeah.
It definitely doesn't have that personal touch
Yeah,
to
I
it.
think our average patient visit is about 20, 22 minutes. That's average. So it could go longer than that, it can go shorter than that. We certainly a lot for longer visit times than most providers do,
Hmm.
most commercial providers.
And then the actual treatment and the exact services you guys offer, do you extend beyond some of these HIV testing and treatments? I mean, do you do regular healthcare as
Oh
well?
yeah, yeah. Our bread and butter is primary care,
Hmm.
and certainly within that community. Um, and onto that, again, being part of the community, a lot of that is, prevention related, sexual health, those sort of things. Also behavioral health. So we are,
That's a huge piece of it now,
we're
right?
really, really huge. Talk therapy, really, again, the pandemic took off during the pandemic. It became really, really difficult to find and hire actually really good therapists. That has changed a little bit. Also, with the model, we're one of the few healthcare organizations that actually takes insurance for talk therapy.
Mm.
Oddly enough, it's very hard to find a therapist that takes insurance. So that's been kind of a good influx for us. And then also psychiatric. So that is, it could be a mix of talk therapy and medication. Maybe it's just medication. So, and that's where you get into sort of more deep behavioral things. But all in all, we do housing support, we do food security,
That's amazing.
we do work with expecting at-risk mothers through our program. And, I mean, a large part of what we do, the nice thing is, and I'd be remiss if I didn't say this, is that our insured patients, because of our connection to the community, we obviously have a lot of professionals, that come to us, and those insured patients pay it forward for those that we treat that don't have insurance. So in 2022, insured patients helped deliver, then I'm going to try to get the number right here, $660,450 in healthcare to patients that don't have insurance or underinsured, because you can be underinsured as well.
Wow, that's
Yeah.
amazing.
Yeah.
And is that a program through Metro? Because that sounds similar to kind of the way insurance operates it, on a national level too, right? You're almost subsidizing some of the folks that can't afford insurance.
Yeah, the way it really works is we call it, I actually coined it as one of the first things I did when I got there. I called it the Co-Pay It Forward program. So if you're a person with insurance, you come through the door, use your normal copay. Part of that, or a good portion of that, goes back into treatment for folks that don't have insurance. So there is a national program called the 340B program. Because we are a not-for-profit, we're able to purchase certain medications at a discount, but we can bill the insurance companies a fair amount.
Mm.
I like to say we make the insurance companies and the drug companies work a little bit harder, because God knows they do pretty well already. But yeah, so we transformed into our Co-Pay It Forward program, and that it does a lot of things. It's not just delivers healthcare to folks that have insurance, but it also helps us create jobs, and also helps us to create good paying jobs. So it's an important part of our strategy as an organization.
That's awesome.
Yeah.
That's fantastic. What a Is that a novel idea? I mean, did you come up with that yourself?
The co-pay it forward?
Yeah,
Yes, I came up with that
that's
part of
awesome.
it. Yeah, I just branded it. That's all.
I
It's
mean, I
all
like
on
the
the
name
branding.
for sure. You got the name. Yeah,
Yeah,
it's all in the
it's
branding.
trademarks now too. So
That's
don't go
awesome.
getting any ideas.
Yeah. Let's jump back to Seminole Heights in that neighborhood. You were mentioning, you drive down the street, there's a bunch of pride flags, and beyond that, there's every kind of flag. I mean, I think that neighborhood is such an expression of our city's diversity. I mean, Tampa Heights included, Tampa and Seminole Heights have literally every color and creed and religion, and it's kind of an incredible place in the city, and a lot of other neighborhoods don't necessarily express it the way the Heights does. So I think for this type of service, you guys are boop smack dab in the middle
Oh
of it
yeah,
on a prominent street corner.
very much
So
so.
I'm very excited for you guys.
Yeah.
Now, let's jump to kind of the future. So your idea and Metro as a whole is to do more of these local kind of neighborhood oriented clinics, do you call them?
We call them health centers.
Health centers.
Yeah.
So is there a number in mind? Would you like to have one in every neighborhood in Tampa?
When we're all said and done, we'll have 9 to start. So that'll be pretty significant. But I could see us easily moving into other markets just outside. I mean,
Hernando County, I
we
mean,
could do it. Yeah, sure.
I mean, if you have
Lakeland,
patients,
absolutely, we
yeah.
could do it. South of the Skyway, we could do it for sure.
It's kind of amazing how many members of this community are in the Tampa Bay area. I have a member of my family, and she's from Indiana, my wife's sister, and there was no one like her up there, and there was certainly no thought of something like Metro up there. And when she moved here, she couldn't believe the camaraderie, and she's already had a couple girlfriends and met some other people, and it's like by moving here, her life was exponentially better because now she's around people like her. So I would imagine as Tampa grows and as more people move here, you're going to get even more members of the community that see a business like Metro and go, "Oh my God, it's a no-brainer for me to move there."
Right, for sure. Yeah. No, I think we have, we in St. Pete have always had a really good relationship, and in some cases partnerships with the city in doing things. They've always had us involved in many things, and same with Jane Castor in Tampa. It's not unusual for her to be talking about the community and drop Metro as an example of the impact here that the community has. So it's definitely, I think, a selling point if you're going to move to an area and you are a member of that community. And if you are, I remember we had a bunch of people when Twitter went on work from home. I don't think that's the case anymore, but we had a ton of people move here from Twitter at that time and ended up with a few as patients at our place. So you're definitely seeing that happen for sure. It definitely is a plus.
Jane Castor's been a huge part of that.
Yeah, for sure. There's nothing like visibility. Visibility is the most important thing.
I think she's the only gay woman as a major mayor. I think of any city in the United States. I think I'm pretty sure. So having that at the top level is, I'm sure, a huge help for visibility too. Have you been approached by publications outside of our area and outside of Florida that are seeing what you guys are doing and want to replicate some form of it in other markets?
Um, you know, we do. There are organizations like us that are similar in other markets. I don't think that they are as expansive as we are. And it's important for me to say too is like even though the large majority of our patient base is LGBTQ. There's, we don't turn anybody away. That's the thing. And so we have patients that, sort of straddle the spectrum, as it were. And certainly those that are maybe a little bit more in need of services that are not really, there's no resources for. So, We always say that it's just really our history, where we started 30 years ago, that sort of gave us a connection to the LGBTQ plus community. But we have many, many allies that also
Oh yeah.
take services there as well.
Well, it's also in the name, right?
Hmm.
Inclusive healthcare. All are welcome, including you. I mean, you guys
Hmm.
promote very heavily that all are welcome. And why not? I mean, you might get people who walk from all those houses around this new building in Seminole Heights that, hey, I'd rather walk to receive my health care than drive 15 minutes or
Sure.
further.
Uh,
So I think you guys will be successful way outside of the community because of the location, because of the brand, because of the depth of service you guys offer.
hmm. Yeah.
Um, so let's talk about your social media.
Okay.
So you started That's So Tampa and I Love the Berg.
Yes, my partner and I started. The original one was I Love the Berg back in 2009, I want to say.
That's so long ago.
It
That's
was
such
so
a
long ago,
pioneer
right?
account.
It's and it was just really a Facebook page. It was funny because it was the depths of the reset or the what do they call it? Not the
The
recession,
Great Recession.
great recession or whatever it was. And we were just running our little rinky-dink creative energy agency out of our home office, and decided, hey, what would be a great way to show we understand this new thing called Facebook, and that was pre Instagram and pre all those things. So we started that up, and it really was just a Facebook page that was sharing stuff, and then it grew obviously into what it is today. It's been its own beast. It's sort of paralleled the major. All those numbers are wrong, by the way. We have way more than that now. I'm gonna have to get on them about updating the
I
website.
looked up your Instagram. You guys have, I think, 200,000 followers
On
on.
just Tampa, I think. Yes.
It's insane,
Yeah.
man. I mean, your numbers are unbelievable. You rival some publications that have been around a hell of a lot longer
Oh
than
yeah.
2009. So
Hmm.
that's exciting.
Yeah. No, it's been great. I mean, it's really. It's been, it's one of those things that has afforded us the ability to do many things that a lot of people who get a chance to do. And it's been it's been good to kind of grow with the community, I mean, and
Hmm.
to see it. And I remember the time at which, and I started my career in New York in public relations. And I remember when we were working on this and we started getting press releases after we had launched the website, and I'm like, oh yeah, we made it, we've arrived.
Yeah, now your numbers are
Right.
10 times, 100 times what they were. So this started as just essentially a passion project.
It was, yeah. And now it's, I mean, since I have taken the job at Metro, my partner really runs the day to day with a really amazing team. And, he's just really grown it into the successful business that it is now. I mean, it really is. We say it's the largest independent social media network in Tampa Bay, and it really is. I mean,
Right.
there's just nothing that is doing what we're doing.
It's very simple too. It's, anything from a new restaurant to a new business to news releases.
Hmm. Where to eat Thanksgiving, dinner
You're
at a
right.
restaurant. Those are the things that are like everybody wants to know. We get emails, a handful of emails every year. Will you guys publish the restaurants that are going to be open on Thanksgiving list? So it's funny how things have
Yeah.
come. People expect things to happen now.
I notice you have an email list. It said on the website, I think 17,000. I'm sure it's a
It's
lot more
bigger
than
than
that.
that now. Yeah.
What is the email? So that's kind of what it is. People emailing in and requesting certain
Yeah,
things.
there's a daily that goes out that's a summary of just what's been published on the site, and then we do the weekend list of events. God forbid we're 5 minutes late on that, people have a heart attack. And then Sunday we do like a review email list of like all the top stories and events that are happening in the week that are coming.
The engagement's unbelievable. There's been a lot of other pages that have popped up similar, but you guys have been around for so long and established yourselves. You're going to be hard to topple. Look at the numbers: 150,000 views, 120,000 views.
We do.
It's incredible. That's what we're trying to build here with this podcast and our Instagram. Pull up our Instagram, Tyler. I really like how That's So Tampa and I Love the Berg has a community, kind of like you mentioned, right? It's like people commenting, interacting with each other, sharing ideas, sharing stories. We do like history, Tampa culture, businesses. We're, I would say, real estate focused. And then we'll drop something like this. And typically, this post, which was when was this? 4 days ago. Would you ride a modern streetcar? So we talk about transportation issues. We talk about the old trolley system, and we do a write up on it. Posts like this get the most engagement, and I
Mm-hmm.
think the same reason we get this engagement on posts like this is the same reason you guys always have, and that's because people want to get centered around an idea and talk about it.
Right.
Whereas the other posts, if it's just about a guest I had on or a clip of the podcast, it doesn't do nearly as well. Granted, we've had some incredible viral moments and stuff like that.
Well,
But
the fast growth that we've had, I mean, everybody I think has really got transportation on their mind. It's, it's so funny because like I say my commute, and when I started at Metro, my commute was about 6 minutes from downtown St. Pete to our location. Now it's 9,
and you haven't moved.
and I haven't moved. So that's just an idea of how things have like really blown up, right?
It's insane. We have such a long way to go, though, man. I mean, it's like, I think transportation's a major issue. Affordability is a major issue. You guys are solving an awesome issue with Metro, providing that type of care for those folks.
Well, and
But
that's I will say it's only going, the cost of healthcare that is rising, and even copays have risen so much for folks that have insurance. Metro is now subsidizing about $8,000 a month in copay assistance just so people can access prescription. So there are people out there that can't afford their $100 copays for essential medication. So it's really, and those things, that's money that comes from nowhere. So that's some of our fundraising and development stuff that we do. We just had our first event in October for the first time since the pandemic. And we raised about $160,000, I think. Not bad. I'd like us to get better at it. But, those things are really the pocketbook issues, the food insecurity that we see, and the housing insecurity that we see. We have a housing program now that we're really helping people get set, and it's one of those things where it's the gaps, right? There may be programs that cover certain things, like they may cover rent, but they don't cover a security deposit, or they may help you with utilities, but they don't cover you for deposits on your utilities, that sort of thing. So we try to fill in the gaps because it's all about, for us, it's about keeping people in care. If you don't have housing security, you don't have food security, you're not really worried about getting your health care, So all those things are really important to keep people in care. In 2022, we spent, it's on our website, I can't really quite remember. I think it was about $60,000. If you go to the website to the Give tab, you'll see it in there. We did, I want to say it was about 50 something thousand dollars in just transportation. That's getting people to and from their medical appointments. The average Uber ride was $30 to get people to and from.
it's really a shame we even have to.
It's a
It's
shame that we
sad.
have to talk about
Yeah,
that,
it's
right?
sad in this country that this is some of the issues that are coming up. I mean, people can't
That
even afford
donate
$100 copay. It's really horrible. I mean, do
You hit the
you
donate button on top
see the
right.
top right,
There you
Tyler?
go.
So you set up a program where people can donate that fills the gaps that you're talking about, whether
Right.
it's transportation, whether it's a security deposit that they can't afford on a place to live. That's amazing.
Yeah, we have a lot of, so those are in that 340 in 2022 is out of pocket. So that's non-funded. And these are all the areas that we try to help folks stay secure.
Are there gaps that you see? Do you see a way because of where you're at? You're dealing with patients. You can kind of see where people have issues paying for certain aspects of what they need. It's kind of a tough question, and people get paid a lot of money and are in high positions to answer it. But what is the answer? I mean, what do you how can we bridge these gaps it without private enterprise and individuals having to fund stuff like this? I mean, the government seems to have money for so much, and yet people can't afford a Uber ride for healthcare. Like
Yeah.
without you guys raising donations and being a nonprofit and helping people out, what would these people turn to? I mean, have you had
I
people
really,
off the street that
oh yeah.
come in
Yeah, we
and
have people. I was leaving, I will never forget, I was leaving work this is probably a good year ago. I was leaving work and a gentleman, I was working late. It was dark outside. It was wintertime. It was probably about 7 o'clock, and this gentleman walks up to me and he says, "Hey, I'm sorry to bother you, but do y'all have any? Do y'all have any food you can give me right now?" And I was like, "Yeah, hold on a minute, let me go in." And I knew where the pantry was, and I ended up calling someone in operations because it has a code on it, and I'm like, "Okay, I don't know what the code is." This guy, so and I was able to give the guy a little package. So, people seek us out for things like that, even at all given times. And it's not unusual for us to have someone walk in off the street that doesn't have an appointment and doesn't have resources. And it's just like, I'm just sick. Can you help me? And we do. We don't turn people away. We are, because of our status, we are required, if you don't have insurance, we do what's called a sliding scale fee. So, and that is just based on your income. We ask for, your pay stubs and your expenses and all those kind of things. And then we evaluate what people can afford to pay if they're getting services from us. But if they don't have any of that, they're still getting care. We're not
right.
going to turn them away.
Yeah, I think Panera Bread even had a similar model where there wasn't prices fixed to certain food items. It was more like kind of give what you can type deal.
Yeah.
Yeah, I mean, it's such a complicated issue.
Well, and it is, inflation hasn't helped, obviously, and
Especially in healthcare.
the density here, with the rise in housing has not helped. And it's, for me personally, and then sometimes we talk about this on the blog side of things, is the imbalance that it is has created and could become severe, and that's how do you have folks living in multi-million-dollar condos downtown, but also finding people that can afford to work in a restaurant and live here, sort of thing. Like, when does that become so imbalanced that, it just doesn't work anymore? So those are the things that are really, so I think, finally you see people getting serious about affordable housing projects in St. Pete. And I haven't really stayed up on it in Tampa, but I think there's some things going on over here as well.
There's a huge project on the west side of the river. Related Group, Tampa Housing Authority, and I think Federal Housing Authority are involved. Huge project. You can look up West River Development. Thousands of units, mixed use, and really in a great location, kind of just south of the Heights, really. So I think you're right. It is happening. There's clearly the scale is off. I mean, when you see some of the condominiums they're putting up, and then at the same time, some of the kids younger than me who recently graduated college and are looking for a good job, they need to move back home or they need to go back up north. They can't stay here. And for us as a city and just as a metro area to lose college educated, willing and able people that want to work but they can't afford to live here, that's horrible.
Right. And it's not good for the long term of our own economy and property value, because if it gets so expensive for folks to have, just a regular old job,
Yeah.
how the hell are the rest of us going to afford to live here?
That's exactly right.
So,
yeah, I mean, the service was a good point too. There's a lot of people that service a lot of the restaurants and you name it, right? If those people can't afford to live here, you're going to be stuck with a serious issue.
And I obviously we write a lot about restaurants and bars and everything, but I never thought I would see the day where I was paying $18, $19 for a cocktail in Tampa Bay. I just cannot believe that.
I completely
and I'm
agree.
not blaming the restaurants or the bars for that. I realize that this is something they cannot really balance out.
Sometimes you get what you pay for, sometimes not.
And that's the bad thing, right? Is sometimes it's not that good.
I was at last night. I had an old buddy of mine in town. We went to Predalina and Water Street.
Yeah.
High-end restaurant. I mean, I expect to pay a lot of money. Food was incredible. But yeah, I mean, the drinks were $25 a piece.
Jeez,
it was
good
kind of
Lord.
insane. And then we went to the Edition and got espresso martinis afterwards. And with tip, I tip very well. $71 for two.
For
We
two
each had
people?
one.
Oh
We
my
each
God.
had one espresso teeny, $71. Now I gave a $20 tip to the bartender, so it was $50, but still like $25 a drink. You know,
$75 is a really nice bottle of vodka.
I
A really
know.
nice bottle of
We
vodka.
could have went to ABC Liquor and had probably more fun at home and spent less money. But that really is the imbalance. You know, there has been so much focus in this city, in St. Petersburg too. I
Oh
think
yeah.
Tampa has more of a problem with it, where you have so much high-end development. There's so much in Water Street and Bayshore Boulevard. And then you can kind of drive like up to Seminole Heights, and there's people living on the street not too far away.
Mm-hmm.
It's a weird thing that seems to be getting worse and worse and worse.
Yeah.
I'm 31 years old. I haven't seen, I've only been alive for so long, right? So I only have a certain perspective, but it's definitely gotten worse in my lifetime.
Oh yeah, and it's getting worse and worse everywhere. We have friends in Denver, and I was out there not too long ago, and their homeless population downtown is disturbing.
Hmm.
In St. Pete, we've always had Williams Park, which has always been and continues to be. So not always, but a place where people who are down and out are gathering. There's nowhere to go if you can't afford basic rent, you can't afford really low rent either.
Hmm.
And there's none of that. So what do we do? It's the big
Even
question.
even on my scale, I mean, I'm looking for a house right now. I can't find a house. I do pretty well, and I'm looking for a home, and it's tough for me to find a home right
Hmm.
now. Anything in South Tampa or even Tampa Heights is very
Yeah.
expensive now. So I don't know what the solution is. I don't know if any one person has the answer, but I believe that filling the gaps like your company does is a big part of the equation.
Hmm.
I had on Isaiah 117 House. I don't know if you've seen them or seen
No.
that logo before. They're new in town. What it is a franchise model of a foster home. It's not really a foster home. What it is, when a child is removed by Child Protective Services from, a neglected home or an abusive home or whatever the case is, when that child is removed, traditionally they would have to sit on the floor of like a case officer for a couple hours before the foster family got there and picked the child up. So Isaiah 117 House provides a home that they can immediately go to, take a shower, have a warm meal, whatever that child needs. So this is their Instagram. And what the reason I bring them up is they are also finding a gap in
Hmm.
that specific niche, in the foster care niche. Hillsborough County has the highest number of kids in foster need in the entire state of Florida.
Holy cow.
So they've seen that niche and they're doing something about it, just like you guys are.
Hmm.
So I just thought that was kind of an
That's a
interesting
great
correlation.
organization. Yeah.
It really is. They started, what was it, Tyler? Tennessee, Kentucky, somewhere. Yeah, they've really grown their model because of a gap in between private enterprise, foster families, and then governmental CPS, and they've bridged that gap. It almost sounds similar to what you guys are trying
Hmm.
to do,
Yeah.
right? You're kind of bridging the gap between the uninsured and the insured, and the people that just need simple quality health care, and the people that can't afford it or can't drive to it.
Yeah. It is. It's a conundrum for sure. And we deal with a lot of young expecting mothers too, who are considered at risk. We give them a starter bag, which is like all the basics. If you're a mother, what's $1,000 as a starter bag? $1,000 is an incredible amount of money to a lot of people. So, you know, we're trying to figure out how to fill the gap after the starter bag is gone, and it's not easy. It's a vicious cycle. If folks are not given at least some sort of opportunity to make it, they might not. You know, and that's the sad thing, because it is it is not, if the opportunity is not there to have some sort of opportunity, then what does that person resort to? What do they become? How does it turn out for them? And this is the vicious cycle sometimes that we live in.
And it's a failure of our society to let that happen. And the fact that it happens so much is shocking. And I believe that our area does not have it as bad as other areas across the country.
Oh no, I don't think so. Yeah.
You know, we do have it pretty good, for whatever the reason. There's a lot of people that have moved here since COVID, and sunshine, no income
Right.
tax is obviously a part of
Right.
it. But
Right.
the migration pattern has helped us in a positive way. If you look at San Francisco or New York or some other major cities that have had population decline, they have an incredible problem at an exponential scale with the type of people that need help, like we're talking about. And I don't know if they are going to have an easy way out of it. Whereas where we're at, if we can find good solutions, if we can learn from other cities, if we can really come together, we could put a real dent in this
Right.
equation.
Well, you have to also keep in mind that those places are the way they are also because they also experienced rapid growth and the solutions were not there. So this is the importance of us having real conversations about filling those gaps, because it would be easy for us to fall into that model too if we're not watching out carefully. That's what happens, you know.
Yeah.
I mean, if you look at the boon that California had for so many years, the influx of people that wanted to live there, it's a beautiful state. Who wouldn't want to live in California? Weather's great.
Best in the
But if you
country.
ignore, unfortunately, and it's not, I hate to be like, one of those people that says we can't ignore the people that need help, but you can't ignore the people that need help. Otherwise, that's what happens.
That's a good point too.
Yeah.
That population growth is it even manageable? Number one, and then number two, can you really stop people from moving to a beautiful place like Florida, like California? No. So it's really growth management, and
It is.
it's putting up safety nets for people and helping people and bridging the gaps along the way as you grow. You're not going to put up a fence and say, all right, one by one, only you can enter, and we're going to try
Right.
to figure out a way to have manage. You're not going to do that.
Because the more expensive a region comes, and it's like you can see history repeating itself, right? Okay, so the more expensive California became, the less opportunity there were for people. So that's what we have to be careful about in the Tampa Bay region, is we have to make sure that that doesn't happen here, because it could. It is ultimately history repeating itself. We have to be careful here.
We do, and you really could already see it. I mean, there's certainly more homeless people. It's tangible than there was 5 or 10 years ago.
Right.
It's very clear to see. There's more people in need, period, than there was 5 or 10 years ago, just because we've had a bunch of people move here. And I think even people that needed the opportunity for whether it was a job or a better place to live, or even homeless people, I'm sure have migrated. You're just going to get everything. You're just going to get every kind of everything here. And a lot of people complain about the traffic and the growth, and they look at a new condo tower and they think that's the problem. Really, we need more growth. We need more places for people to live.
Sure, better density, sure.
Yeah, we need better density. I'm really glad that's being talked about. And I'm glad our current mayor has made that at the forefront of her conversations. Public transportation, more streetcar. You probably just saw they're trying to bring the Brightline station over here. And all of that's I think all of it is a part of the same equation. And what you guys do, you guys are a big part of that as well.
We're trying to be, yes.
Yeah.
And transportation is increasingly, I always say it's got to be really frustrating to order a sports car in this market.
Yeah.
You can't really get it out of third gear, can you?
No. And good luck down the brick streets and the potholes. And
Yeah.
apparently there's more supercar collectors here than almost anywhere in the entire country.
I don't know where they're going. You can't get above 35 on most streets here, not even on the highway, for God's sake.
No, good luck driving your Ferrari down 7th Avenue in Ybor.
Right.
You're going to hit the granite curb and blow your rim out. And, going back to the new location in Seminole Heights, is there anything different you're going to be doing in that building that you haven't done before? Or is it just an extension of what you already have?
We are trying... we're trying to make sure that all the locations are full service, actually. So we do so many little, we actually, if you count it up, we actually offer over 100 services at our organization. And,
Wow.
And that is in 90% of our patients get more than one service at Metro. So that's so we're trying to make sure that all the locations have the ability to offer and duplicate across the board. Now, however, having said that, we also realize the advent of urgent care and also online services as well. So I think our what we'll look to do is try to expand more of the automation and virtual services. So we are doing online scheduling now, which has been great. And something that I kind of was pounding on the table that we needed for a while. And then being able to do certain prescription services over online as well. So I guess to answer the question, I don't think we'll expand services at the locations. Our goal is just to make sure we have everything for everybody, but then I think the two growth models for us will be some online as well as looking at other locations for
Yeah.
sure. Yeah.
Yeah, you want to spread you want to spread out and at the same time keep your quality of service, of course.
Correct. Yeah. And the nice thing, honestly, we've found is the smaller health centers run so much more smoothly. Trying to operate a big health center with so many moving parts, it's sort of somewhat counterintuitive having all the, thinking that having more places would be more complicated.
That would be my impression.
Really not,
Yeah.
because the folks that work in those local regional centers really have a sense of ownership. And for us too, it's really like, the person that works at the front desk knows every patient's name, and, there's more of a personal relationship. So, our I will say that our tagline that we introduced a little over a year ago is "You Found Family," which has a bit of a different double meaning to it. So once we started offering all those services, it's kind of like going back and going into this smaller model. It's going back to the family doctor, where
Yes.
you had like the family had one provider they would see, and you knew everybody's name, and, when they were graduating from high school, you knew all these things about your patients, right? And then the other side, obviously, is the LGBTQ, the whole finding family. So we're really trying to keep what makes us special there, but also really become a lot more. And this is what we can do that the CVS's and the Walgreens and all those folks can't do.
Right.
Is really make it a very quaint neighborhood family experience in coming to our health centers.
So here's a timeline of
Oh,
Metro's growth. So 1984.
Yes.
Wow. Began provision of services to HIV positive community of Tampa Bay through King of Peace Church.
Yep.
All the way to today. Now, what is Ryan White Services?
So Ryan White, if you remember, he was the young kid in the 80s that had the blood that got HIV positive and AIDS ultimately from receiving a blood transfusion. And he was very, this is just how young you are. You'll have to go up and look this stuff up. But he was basically an icon of the, the whole AIDS crisis in the 80s, because he was just this kid that had hemophilia, and I believe it was hemophilia, and had a blood transfusion and contracted AIDS that way. And he was shunned by his fellow students and parents, and this was all that misinformation stage. Nobody knew anything, right? Just like we didn't know anything about COVID, and now we know so much more about it. And he eventually died, and he became sort of I hate to use the word poster child because it's so trivial, but he became kind of I like to say the icon, because he really was now in our history of the misunderstanding and the myths that were behind AIDS and HIV back in the day. So anyway, there is 4 folks that do not have insurance and that are living with HIV. The funding that comes from the government is named after him, Ryan White.
So it's a testing service, or what exactly is it?
It's if you are living with HIV and you need care, it's a number of things. So that is your coverage for your care living with HIV.
So it's coverage for insurance.
You're covered for insurance. It does include housing and other aspects to it as well. So one thing people don't realize about living with HIV, and when we talk about ending the HIV epidemic or bringing numbers down, That whole idea of getting to undetectable, if you're living with HIV, getting to undetectable, meaning that you cannot pass it along to somebody else, that means you're part of the solution, honestly. So when we say it's important to keep people in care, it's incredibly important for people to stay in care and reach that undetectable status so we're not seeing additional patients with HIV. That makes sense.
That
It's
makes
like,
complete
you know,
sense. The better job you do, the less
right,
people that you
correct.
have to. I
Correct.
wouldn't say cure. That's not the right
Not
word.
care or treat. Yeah.
Treat, but in a kind of a weird way, cure is the word, right? I
It's
mean,
not a full cure.
but if
It's
you
about as
can't,
close as you can get to it.
right,
Yes, for
maybe a
sure.
technical cure where you can't transmit the
Right.
disease. I mean, effectively, you are off the table,
Right.
right?
Yeah. As long as you stay in that treatment.
Yeah.
Yes.
And then I also noticed too, I guess the headquarters of your parent company is over on Nebraska in Ybor City at the.
The headquarters is in St. Pete. That's the one on Third Street and 33rd Street, Third Avenue.
What's the location in Ybor over there at the? I think it's the German
Yeah,
American
it's
building.
just one of the locations
One
that
of the
we have. Yeah,
locations, yeah.
yeah.
And I
It's our
noticed
second largest. Yeah,
it's a big building.
yeah. But that's what one will break out. We'll be out of that one by the end of the year, and that's all of our patients will be going to Seminole Heights, Fletcher, and Brandon from there. In North St. Pete, we have a location in the Gandy area that is obviously very tangential to
Yeah.
Tampa. So we have some patients that will go there as well.
Yeah, I drove by there, the one on Nebraska, the German American Club. Beautiful old historic
Beautiful
building.
old historic building, but a perfect example of why it is so expensive to run. I mean,
Who owns that building? Is it a lease by, does the city own it?
we sold it to our partners that we had some ownership with, including the Capitano family. You may be familiar with them. They own a lot of Ybor.
Right.
And they, but that German American club, and mind you, there's that building. The German American club was there since it's like 150 years old or something like that. And then the one next to it is a new structure. But, I mean, just to air condition that building, God knows how much it cost us every year and all that, because it's historic. So you can't put a light bulb
Right.
in without asking somebody,
Yeah.
right? So that was really an example, a learning experience, I think, for the organization, in that, we could be operating a lot more efficiently if
lot
we
more
weren't
lean.
taking, if we weren't these, landlords, basically, is what it is,
Right.
taking care of a piece of history, which is beautiful. I'm glad we were a part of it. It was a learning experience, but
It's certainly cool.
we're going to leave that to somebody. We're going to leave that to the museums going forward.
Exactly. Yeah. You drive by it and it puts an impression on you. It's really
Yeah.
a beautiful piece
Oh,
of
it's
architecture.
gorgeous. It's beautiful.
What are the? I see you guys have like mobile command units or some sort of a on wheels care system.
Yeah,
Explain that.
we have a unit. We have 4 mobile units, and those are used in a number of ways. They're used for education as we're out there in the community, and we can do testing and vaccines in them. So a lot of times we'll go
that's
to.
cool.
We go to seniors locations or, again, neighborhoods where they may not have access to good transportation below the poverty level. And we go in there and we do education. We try to keep people vaccinated for the flu and COVID and all that kind of stuff. It was really big for us in early in COVID because we were one of the first health centers in the Tampa Bay area that had gotten the vaccine, the original very first vaccine. And there was so much hesitancy, as I think everybody knew, and particularly in communities of color. And so that was really a great tool for us to get into communities and educate them about it and get people vaccinated, which, probably saved a few hundred lives easily, as it were.
Yeah.
So those are a great sort of extension of how we can get into the community and take the medication to places where, it's hard for folks to get anywhere sometimes, and that's a mix of both economic but also age and, people that are seniors and just don't quite have the ability to get to places.
So
and
you're
get those
essentially
services.
making a house call if someone can't
Basically,
make it to
we'd
the
call
location.
we'd probably call it a neighborhood call, but yes.
Right.
Yeah. or a
Oh,
location
so
call.
you'll
Yeah.
actually set up on a street in a
Oh yeah.
neighborhood and
Oh
have.
yeah. We'll go to a neighborhood.
Oh, that's cool. Very cool.
We go to events. We are at usually at a lot of the gay bars over the weekends. Sometimes here in Ybor, and sometimes in St. Pete on Central Avenue. So education, testing, vaccines, enrolling people in preventative measures, handing out condoms, all that great stuff.
Of
We
course.
handed out like over 120,000 condoms last year. I think was
The more
the
the better,
number.
man.
Yeah,
Oh my. Yeah, especially around here. Ybor City is a crazy place.
can be.
People have a lot of fun. That's
They
for
sure do.
dang sure. I remember Gaybor was kind of a big deal. When was this? Early 2000s. It seems to have dropped off. I wouldn't know why. Maybe
I don't know
demand.
either. No,
I mean,
just
there's still gay bars and
yeah.
all that sort of stuff. It was so funny. My family owned a hardware store on one block north of here, 8th Avenue. It's where Rock Brothers was, if you're familiar with that brewery.
Yeah, oh yeah, yeah.
And my family closed the hardware store in the late 1970s. So it's been 50 years since they closed up. And I went to a gay shop, I guess you could call it, with my grandfather and my father. And my grandfather, he was a politician, and he was always a old school Democrat, didn't care who you were, where you came from, that type of deal. And he walked in and laughed his ass off. Like he enjoyed he was like, my mother would be rolling in her grave. She was born in 1901 or whatever. But he was enjoying the fact and laughing his ass off that they had some sexual items hanging all over the walls and
Sure.
stuff like that. And I remember at that time, this was the early 2000s, there was a lot of those places around this area. And I don't know if all of that shifted over to St. Pete or where it went, but it's interesting to me that it's died down a little bit.
Yeah,
Have you
well,
noticed that?
yeah. I mean, I think there's a couple of feelings about it. I mean, like, you know, acceptance in the community
Yeah.
meant that there was less need to go where you only had people that were like you, right? Like
Right.
people became more opening and accepting. We could all go to bars together, no
Right.
reason to have our own, right, so to speak. So I think that
Which
sort
is
of
the
changed
entire,
things.
not goal, but that's the perfect world, right? Where there's a
Oh,
bar
sure.
and everyone's there. It's
Yeah.
very, very similar to Metro. Where,
Yeah,
hey, we're all welcome.
and so, but I mean, there's still the clubs, and and I think that's largely fueled by the entertainment and the Go-Go Boys and the drag shows, and
Yeah.
all that kind of stuff that folks like to get into. But I think, I remember my time in New York. This is a great sort of segue to talking about how history repeats itself. When I moved to New York, and Times Square was like that. It was sex shops and all that kind of stuff.
Yeah.
It was very, and now look at what it became, right? Full circle. And I think, that was largely where, people just kind of became okay with other people being gay or lesbian. It just didn't really matter anymore. People
Yeah.
became comfortable with it. And I've always said the reason we have gay marriage in this country is because one of our presidents made it a talking point. So when you open up the discussion and you start talking about things, then it demystifies it, right? And the scariness starts to go away. And it's like, oh, they're just kind of like me. Just, they like men. That's all.
I think
And we get over it,
people
yeah.
just stop giving a shit at a
Right.
certain point. I don't know. I feel like gay marriage is just marriage now. I don't know that anyone cares as much as they used to. And that's a great
at all.
thing, right? That's a positive thing. They actually so my grandfather got such a kick out of that sex shop that the local Pride community made him the Grand Master of the Pride Parade.
Grand Marshal.
Grand
Yes,
Marshal
yes,
of the
yeah.
Pride Parade.
Yeah, good.
So there was people, the people hanging out behind the bleachers and all that with I love Dick. His name's Dick Greco. I love Dick. They're hilarious. But is a part of that kind of the flamboyance and the colors and all that to put out there this is who we are. Wouldn't it be the perfect world if there was no Pride Parade? And what I mean by that is it was just yeah, we're all here, we're all hanging out, who cares? We're all people and human beings and we like what we like. Do you know what I mean?
Yeah. I don't, the thing is that I think it's one of those it's like the same reason that we acknowledge 9/11 every year, right? Because we don't ever want to forget where we came from or what had happened, right? It's one of those things. It's the same reason, we have Mars people wear pink every October to remember that, maybe breast cancer is not quite as bad, but if we slip back at any moment, God knows where it could go, sort of thing.
Because history repeats itself.
Because history repeats itself. So, having those is, and, just like we were talking earlier, visibility is really important. Having that first openly gay mayor is incredibly important because it just starts to knock down the stereotypes, it knocks down the barriers, that sort of thing. So I think, in a perfect world, sure, why do we even have to talk about it at all? But we have to, it's why we also remember the Holocaust every year, right? Because we don't want it to happen again.
Yeah,
right.
name any historical event or oppression. Right.
Right.
That makes sense to me. That makes sense. Well, listen, Brian, this has been an awesome conversation.
Good. Thank you.
I appreciate you coming in.
Absolutely. It was really fun.
So stay tuned, everyone. Metro Inclusive Health, Seminole Heights, open soon. What other locations are opening soon?
We have downtown St. Pete near Bayfront. We have south side of St. Pete, which will be sort of on 34th and I want to say 22nd Avenue South, somewhere around there. We have Fletcher Avenue, which is near USF, and that opens probably right around the same time Seminole Heights does. And then now we also have already opened North St. Pete, Brandon, Central Avenue in St. Pete. And I know I'm forgetting a location, but it'll come to me.
The expansion is real.
The expansion is real.
That's amazing. I love your business, and I'm really happy to partner with you guys, and I can't wait to see what our amazing building turns into.
Yeah.
So thanks again for doing the show.
Absolutely. Thanks for having us.
All righty. Bye, everybody.
Thank you.
Thank you guys for watching this episode. If you enjoyed it, make sure to like it. Check us out on YouTube, subscribe to our channel, give us a comment, give us some feedback. We want to know how we're doing. Thanks for watching. Bye, everybody.